Imagine this. You have a pain-free practice. You look out the windows of your operatory and you see a line of patients going down the block, around the block. You can't even see the end of the line. And these are patients waiting to get into your practice because you're known as the pain-free healthcare provider. Sounds great. Most people make fun of dentists. Oh, who wants to have a root canal? Who wants to go see a surgeon? Who wants to have a gingival graft? It happened to me yesterday. A patient came in and goes, I hear the word on the street is a gingival graft is really painful. Well, it's not real painful. Well, it's painful if you don't give pre and post-operative instructions and you don't do the right surgical technique and you don't make a surgical stent for the patient to wear for 2 weeks so they have no pain. We've developed some technology in our office that I'd like to share with all of you that really gives patients a pain-free experience. And it really is basically the setup. The setup is really important. The setup is giving the proper preoperative instructions and postoperative instructions and telling patients exactly what to expect. We have an expression, you want to overperform and lower people's expectations or something like that. I don't know what it is. It's something like that. I can't remember the expression, but the bottom line is this. You don't want to give patient expectations that you can't exceed. And we do that. We say to the patient, you're going to have some pain, but very rarely will you have pain if you follow these instructions. What's our percentage? I would say 95% of my patients, 95% have no postoperative pain, despite the fact that we do 5 or 6 surgical procedures per doctor a day in our practice. I just called a patient today and they were having some pain, but they weren't following my instructions. And that's something important that we're going to talk about in a second is the postoperative phone call. So let me take you through the scenario, what we do in our practice. We have written preoperative instructions and postoperative instructions for every one of our patients. We give them the preoperative instructions and the postoperative instructions before treatment. There is a link that I'll give you to a video, it's over here, if you click on that code, to a video that goes through this, that has my team working this out to show you each step of the way. But unless you watch that link, let me go over it with you right now. So what do? We give them preoperative instructions and postoperative before treatment. So most people, it's an afterthought. Oh, by the way, here's a narcotic. Take this narcotic if you're in a lot of pain. Today, we don't use narcotics in our practice. Very rarely. Only if a patient really wants a narcotic, because the reality is we don't need them. So let me take you through this scenario. Preoperatively, we ask our patients to take a non-steroidal anti-inflammatory, unless they can't because they're on maybe a blood thinner, or they may be allergic, or their physician doesn't want them to be on it. We have them take that an hour before treatment. Typically 600 milligrams of ibuprofen. We also use arnica, which some people think may be a placebo effect. But you know what the placebo effect is? 60%. If I give someone arnica, they think they're going to heal better. Do I think it works? I actually do think it works because I've been using it for 35 years. We give it both as a cream and as a pill. Cream to be used externally. We also use an antibiotic in most of our cases, and that may vary from doctor to doctor. If I told you what type of antibiotic to use, it would just be my opinion because there's really no protocol for the proper use of an antibiotic and it keeps on changing from year to year. My personal protocol is I give 500 milligrams of amoxicillin, providing they're not allergic, an hour before treatment, and I give them 500 milligrams TID 3 times a day for 5 days. Our postoperative infection rate is close to 0. Without antibiotics, I think it's about 1 or 2%. That's just my opinion. Okay, because the literature is not going to bear me out on everything I say, and every time I review a review of antibiotics, I see something different. But that's what I do, and it seems to work pretty well. We also use a sedative if a patient wants to have a sedative. So there are 4 medications a patient will take before treatment. Non-steroidal anti-inflammatory, an antibiotic, arnica, and a sedative. We also give them instructions about what to do after. We ask them to prepare, get all these medications in advance so they're not waiting in the pharmacy as the Novocaine is wearing off and they're taking pain medication in pain. The data is very clear on this. If you give a pain medication when someone's already in pain, it works less effectively. So it's important to stop the pain from occurring. And once the pain occurs, it's harder to get it under control. So we ask a patient to get all these meds before, take them before, as I just mentioned, and then also get food in the house so they can have a soft diet, and I think that's important that they prepare. I also recommend that they take a couple of days just to relax, no exercise, no travel if they can avoid it. Some people are going to go back to work the next day. I operated yesterday on a neurosurgeon. He was back in the operating room the next day because that's how he's wired. And he had no pain, he just drives through it. But neurosurgeons are different than a typical patient. They can endure a lot more. They do longer procedures and they're under a higher amount of stress, so they can handle things better. I don't know if that's my opinion, but it's what I think. There are certain people that handle pain better. I had my wisdom teeth taken out during lunch and went back to the office in the afternoon. And for me, it was not a problem. So I'm a pretty good dental patient, but some people aren't. So I ask them to take 48 hours after. That's all done in advance. We also give them the post-operative instructions in advance. And post-operatively, we will review all of this with the patient in person. Myself and my nurse will do this. So both of us will go through it in person. We also give it to them written. And on the sheet of written instructions, we tell them exactly what to do. And what we do is we give them Motrin as they leave the office, if they can take that. And I recommend they take 600 milligrams of ibuprofen every 3 to 4 hours on day 1. And on day 2, I recommend they start the day with it. If Motrin is not effective for them, I ask them to take 1,000 milligrams of acetaminophen if they can take that at the same time. All of the literature, and there's been about 20 articles in the last 7 years published, show that a combination of Motrin and acetaminophen, Motrin and Tylenol, is more effective than narcotics. So narcotics are really not needed for pain control. They may be needed if someone wants that feeling of having a narcotic, and that's when I will prescribe them. But honestly, I probably prescribe narcotics twice a year. That's about it. We also have to give them the arnica. They already have it, but we tell them to take it for another 5 days. We also give them a tube of arnica cream to put on the outside of the face, which may or may not lead to some decrease in swelling. But what I've found, and I've been using it for 35 years, what I've found over the last 35 years, patients are saying, I got to cancel my surgery because I forgot to take my arnica. So they believe it works. So if someone believes it works because the power of the mind is very strong, it probably does work, as the placebo effect. So they'll take the Motrin, they'll use the arnica, and they'll take the antibiotics as directed after. No need for a sedative. If they want one sedative that night to sleep, we'll give it to them. We ask them to sleep on 2 pillows. We ask them not to exercise for 48 hours. We ask them to put ice on the side of the face. And they leave. So they've given instructions in the office before surgery. They were given instructions with my administrative person 2 days before surgery. And they're given instructions by my clinical team as they leave. If they're sedated, we give the instructions to their caregiver. So that's all the instructions that we give patients. Now, most people are not very good listeners. It's a lot of information is coming at us all the time, especially with social media, phone calls, emails, texts. We're just overloaded. So this is very important information because this will keep someone pain-free. I want to make sure I get this through to them. So my team calls them that night. We have all of our teammates call them. I call them the next day. Right before I made this video, I called a patient that I treated 2 days ago. And my team had called on day 1, day 2, so I followed up at day 3, which is where most of the pain is going to be, about 48 hours, usually between 48 and 72 hours. I called them up and I go, how you doing? They go, hanging in there. I go, what do you mean? They go, I'm in a little bit of pain. I go, you taking anything? He goes, yeah, I'm taking the Motrin. I go, how often? He goes, oh, well, I started the day with it. It's 1 o'clock now. They didn't take any for like 6 hours. So they're under-medicating because they think they don't want to take too much. A lot of people say, I don't want to overdose on it. You're not going to overdose on Motrin in 2 or 3 days, unless you take, over 2,400 milligrams of it. So I told the patient, I go, take a Motrin now and take 1,000 milligrams of acetaminophen or Tylenol within 40 minutes. Within 40 minutes of taking that, I find that 99% of my patients are pain-free. So once I get them out of pain, then they don't have to take as much medication, and they don't have to take both at the same time. So this is what I've found over my 40 years of practice. We run pretty much a pain-free practice. Almost none of our patients have pain post-surgically, and they give us plenty of 5-star reviews, which works very nicely. But nothing can make me happier for a patient to go through treatment without having any pain. Once they have pain, they lose trust in you, they don't heal as well, they don't think things are working as well. So it's probably one of the most important things I do for my patients is give them those pre- and post-operative instructions before treatment. And we tell them twice, once with my staff, 2 days before with my administrative team, and the third time as they leave the office after surgery. Hope that's helpful to you. That's a protocol I've been following a long period of time. It's all written there. I find that almost nobody follows that protocol to a T. People take parts of it, and I think it's important. The devil's in the details. Every one of these details is so important that if you miss some of them, they may be in pain. And there's no reason for patients to be in pain today. So I think that's real important. I find in other specialties besides dentistry, they're not as sensitive, because they go to the hospital, they go home, they're not giving all that time and attention. It's real important. The written instructions, the verbal instructions, and that post-operative phone call, not only by myself, but my entire team, is real important. And my cell phone is on my business card, so they can call me. Every one of my patients has my cell phone. By doing that, I get very few phone calls because they don't need me. and then I can get it to be the gift to my patients. Hope this was helpful, and that was the gift to you with this information. Have a great day.